this video, I'm going to demonstrate IASTM to the Achilles region. Okay, this is really nice if your client has got Achilles tendon strain or tendinosis, or they're just feeling a little bit stiff and restricted around that area. Okay, so we want to place a small amount of medium onto the muscle tissue that you're going to be treating. I've already put a small amount of medium onto the area just so that there's a film covering the tissue. That's then going to help to reduce friction between the tool that you're using and the client's skin. The medium that I've used today is the Physique lotion, but you could use wax, or you could use oil as well, whatever you normally use in your clinical work. Before we come into the Achilles itself, it's going to be quite nice just to warm up the area. So I'm just using the curved edge here on this tool because that sits quite nicely into the gastrocnemius and the soleus on all of those edges of the muscle. So you can see here, as I'm going up, then that tool is making a really nice contact with the muscle tissue. Okay, so I'm just going to start off with some long sweeps to the area. Okay, so again, the client's getting used to the feel of the tool, and we're helping to reduce some of that superficial tension. Okay, again, as with the other tools, if we found that the client was holding on to some tension, we can then just focus and do a few more friction sweeps, or we could use an edge here to do some of the smaller friction sweeps as well. Okay, and then from here I'm going to come down and focus on the Achilles region. So I'm now going to use one of my smaller tools, and you can see here that that nice small curved edge will sit really nicely into Lydia's Achilles region. So I'm now going to do some focused sweeping on the Achilles itself. If the client was quite active with tendonitis and it was really sore, then I wouldn't come over the top of the Achilles itself. I'd focus just more into the sides of the Achilles. But here, Lydia's just got a little bit of tension, so it's quite nice to go over the Achilles and treat that structure. Okay, then I'm going to come into the side of the Achilles. I'm just going to open up her joint a little bit more here by stretching. And again, you can bring that around the back of the malleoli as well. And then I'm just going to come into that lateral side of the Achilles. And again, bringing the tool a little bit around the back of that lateral malleoli. Okay, then from here, just coming a bit further with those friction slides up the side of the Achilles, and then doing the same up here as well. Okay, then we're going to flush that area, again with some longer sweeping, and then just flush on that medial side and the lateral side too. Okay, so absolutely we could incorporate those techniques over the Achilles within that wider treatment to the gastroc and soleus, and also the wider lower limb too.